Alright, hello everybody. Welcome back to the Axial skeleton. We're pretty much just going to be wrapping up part 2 now, taking a look at the regions of the vertebral anatomy, completing the sternum as well as the thoracic cage. Wonderful, so let's go ahead and just kind of jump right into it. Now, our vertebrae are actually designed or designated by their region that they exist in. So we have cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacral vertebrae, as well as coccyx. Now, the first thing we're looking at up here is cervical. Now, in week 1, when we were learning medical terminology, we learned that cervical generally refers to the head and the neck region, right? So this is actually what's going to be happening with our cervical vertebrae as well. The cervical vertebrae are going to be found in the head and the neck region. There are going to be 7 in total cervical vertebrae, counting from 1 down to 7. Our thoracic vertebrae are a bit unique. Back in week 1, we also learned about the thoracic cavity. That's what contains your heart and your lungs and completes your rib cage. Your thoracic vertebrae are actually what are the articulation points for the ribs to actually attach onto to actually create the rib cage. Lumbar typically refers to lower back. That's referring to like the loin region. Sacral is actually going to be 5 different fused vertebrae, so it's actually all just kind of one segment. It's going to be much lower. It's actually going to be where our hips, our lower appendages, are actually connecting onto the vertebrae. And then the coccyx is generally referred to as like your tailbone. Now, the 5 fuse and 3 to 5 fuse are a few things I never ask about because there's just a little bit too much variation with regards to that. But for just about every patient you'll see, you will have 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar. Now, an easy way to kind of remember, how many vertebrae we each have in these 3 distinct regions is if you think about somebody who has a normal and a very healthy schedule, right? This is a little bit of a foreign concept to STEM majors, but we're going to kind of run with it. So, you should be eating breakfast at 7 a.m. You should be eating lunch around noon, 12 p.m. And you should be eating dinner around 5 p.m. That's a general kind of healthy outlook, if you got a healthy schedule. Like I said, most pre-med majors, pre-nursing, they're not used to that concept because they're always cramming and studying. But hopefully that helps you guys remember that a little bit. So when we get into naming the vertebrae, what we're actually going to do is we're going to take the first letter of the region that the vertebrae is found in. So in this case, all of these C's are referring to the cervical region. And then we're simply going to count them from superior to inferior as 1, 2, 3, 4, 5, 6, 7. Same thing is going to happen with our thoracic vertebrae, just T1 through T12, and our lumbar vertebrae, L1 through L5. So that makes things pretty straightforward and simple. Now you can actually see that some of these vertebrae are a bit colored. They're a little bit different. So C1, C2, and C7, right? These guys are considered atypical vertebrae. That means that even amongst the region that they exist in, they do have some unique characteristics that make them different from the rest of them. One of the major differences between the different regions is something we'll actually get into, some of the individual characteristics found in only cervical, found in only thoracic, or found in only lumbar vertebrae. You could actually see that T12 and L5 are also labeled. To make things pretty simple, when we start to transition vertebral regions, the vertebrae starts to kind of act like a hybrid between the 2 regions it exists between. So T12, for example, is transitioning from the thoracic to the lumbar vertebrae. So it typically has a bit of a unique characteristic as it has to resemble partially the lumbar vertebrae and partially the thoracic vertebrae. But overall, we still count it as T12. Same kind of reasoning goes for L5 as well as S1. But C1, C2, and C7, they're actually so atypical that they actually receive their own name. So our C1 is actually going to have the unique name of Atlas. C2 is going to have the unique name of the axis. And C7 is going to be known as the vertebral prominence. Now, I'm not going to spell that out just because I'm already having a few issues trying to get these words out. But C7 is going to be known as the vertebral prominence, or known as like the prominent vertebrae of C7. That's what it kind of translates to from the Latin. So let's go ahead and take a look at C1 and consider why we're called the Atlas. Now, in Greek and Roman mythology, Atlas was described as a titan that actually held up the sky. right? He held up the entire world. In our instance of this case, our first cervical vertebrae is in direct contact with the skull. So in this instance, you can kind of compare and see the analogy between Atlas the Titan and Atlas the C1 cervical vertebrae, right? Because C1 is holding up our world, or our skull. And Atlas, in ancient mythology, he held up the sky. C2 is representing, or is known as the axis. That's because as we start to get into articulations before the individual vertebrae, C1 actually swivels around on C2 almost like it's on an axis. And we'll kind of see and understand why that's the case in just a bit. As for C7, it is known as the prominent vertebrae due to its very prominent spinous process. And we'll actually get into the individual characteristics of the vertebrae a little bit later on. But C7, it's actually one of the easiest vertebrae to locate as well. If you are to run your hand down the back of your neck and you feel a very prominent bump, that's actually your C7 vertebrae. Chiropractors and physicians that use osteopathic manipulative medicine are actually always using this as a way to kind of figure out where they are in terms of, where they are in the body. Now let's take a look at the typical vertebrae. So this typical vertebrae is going to apply to the entire lumbar region, the majority of the cervical vertebrae, and just about all of the thoracic vertebrae with a few exceptions too. Now, let's go ahead and start with the vertebral body. The vertebral body is the weight-bearing portion of the vertebrae. So whenever we have a shock or the transmittance of weight, it's going to be traveling down the vertebral body. This is the largest mass portion of it. One more thing I also want to do is kind of orientate ourselves to make sure that we're looking at this properly. The spinous process is always going to point to the posterior side, and the vertebral body is always going to be found anteriorly. Alright, so branching off of the vertebral body directly is going to be this section right over here. This is referred to as the pedicle. Now, pedicle actually translates from the Latin as meaning little feet. So if we have a vertebral body, we have little feet that are also going to be protruding from it, right? Now, looking onwards, our pedicles eventually give rise to the transverse process. So a process is just a very bony projection kind of sticking out. Now, this transverse process serves primarily as a site for muscle attachment. Now, it's actually known as the transverse process because it exists in the transverse plane. It's going from left to right, horizontally, right? As we move forward, we now have these smoother portions kind of making up this top gap over here. This is all considered part of the lamina. The lamina is going to be these smoother portions that are the continuation of the pedicle. And once the lamina actually folds together, we form what is known as our spinous process. The spinous process is the singular process that's always pointing to the posterior aspect. Now, the combination of this lamina and this pedicle actually form what is known as the vertebral arch. So if you actually take a look at what we've drawn here, we have the vertebral body and we have this arch that comes up and over and kind of completes this vertebral foramen in the middle. This vertebral arch is comprised of the lamina and the pedicle. Now, the vertebral foramen. Now, we previously described foramen as a hole in bones that allows for the passage of veins, arteries, and nerves, right? Now, in this instance, the vertebral foramen actually allows for passage of our spinal cord. Now, our spinal cord, we previously described it out of the skull as coming down the foramen magnum. And now, it's going to continue through the vertebral foramen. The spinal cord will continue through the vertebral foramen in this instance. So let's go ahead and erase a few aspects over here. Now, taking a look over here, we have our superior articular process. So the superior articular process, superior meaning it's on top, articular means it's going to touch other bone, and process means it's a projection. So all of this guy right here would be the superior articular process. If we have a superior articular process, we must also have an inferior articular process. That's just not shown on this image, but it would be deep to this guy, a little bit inferior on the opposing side. At the very top of the superior articular process and at the very bottom of the inferior articular process, we're going to get this small guy right here. This is known as the superior articular facet. Now, if we actually translate facet from the Latin, it means face. And these faces are smooth aspects of the bone that are actually going to allow for the articulation of the next bone. So if we, in this instance, see the superior articular facet, it is actually going to articulate with the bone found above it, the vertebrae found above this one, at the inferior articular facet. So these superior and inferior articular facets are going to touch onto one another to allow for that to kind of happen. Now we've pretty much described all of these processes, working our way down. The only one we have yet to describe is the intervertebral foramen. Now let's go ahead and draw out another vertebrae. It's the only way this really works. I'm not a very good artist, so just kind of bear with me here. Now imagine you have something like this. Now let's break up the word intervertebral, right? Inter means in between, vertebral is referring to the vertebrae, and foramen refers to a hole. So the intervertebral foramen is essentially this hole that is found between the vertebrae. Now this is actually very different from the vertebral foramen. The vertebral foramen is going directly straight down this center hole. You can also see an arrow kind of showing you where the vertebral foramen is, right over here. The intervertebral foramen exists transversely between the vertebrae, and it's actually going to allow for the transmittance of our spinal cord roots. So the spinal cord is going to be traveling down the vertebral foramen, but at every single vertebral level, some of our spinal roots are actually going to protrude off and travel to various aspects of our body. This happens along the entirety of our body, along our back. It has to connect to different regions of our head, our neck, our upper back, lower back, our legs, etc., etc. And they actually travel through these intervertebral foramen. Now taking a look at typical cervical vertebrae, the typical cervical vertebrae have everything we've already discussed. The lamina, the spinous process, the vertebral foramen, vertebral body, all that kind of fun stuff. However, now we actually see this additional hole on the left and right side. So these guys are actually known as the transverse, and we already know what hole means in Latin. It's going to be, okay, so that says transverse, and this is going to be foramen. Sorry, that O looks like an A, so let's just kind of correct that. That made things way worse. Anyways, transverse foramen is easily the best way to kind of describe the typical cervical vertebrae. All of our 7 cervical vertebrae can be described here. They actually allow for the transmittance of something that occurs much later on in your 202 and 211 lectures for the vertebral artery. But the transverse foramen, this is going to allow for passage of some of our vertebral arteries. And it's unique to the typical cervical vertebrae. So if you look in the thoracic vertebrae and you look in the lumbar vertebrae, you're not going to find these guys. Some of these special cervical vertebrae. So we have C1 and C2, the atlas and the axis. Taking a look at the atlas is going to articulate with the occipital condyles. Those are some of the pointy projections that I pointed out when we talked about the skull, right? This is actually where it's going to occur. So in this instance, it's showing us the inferior aspect of the C1, but the superior articular facet of C1 is going to articulate with our occipital condyles. Now you may also notice that C1 is lacking a body as well as a spinous process. So that's also something that makes it unique. And since it's lacking a body, it doesn't have pedicles either, and it doesn't have lamina either to form the spinous process. Now this articulation in particular for C1 is actually going to allow for us to nod our head up and down in the yes motion. Taking a look at C2, there's only one thing I really want you to point out is this guy right here. This is known as our dens. You can also call it the odontoid process. That's kind of how I learned it back in the day. The dens is going to fit perfectly into where the vertebral body of C1 would be. But since C1 does not have a vertebral body, instead the dens is going to place directly inside, just like so. This is going to allow for our head to spin around on an axis and shake our head no. So if we wanted to shake our head no, we would use C1 and C2 articulation. If we wanted to nod our head up and down, we would use C1 and the skull, or the occipital condyles if you want to get more specific with it. Here you can just see how they fit together once more. For the thoracic vertebrae, so the thoracic vertebrae once again have the usual stuff. They got the superior articular facet, transverse process, lamina, spinous process, etc., etc. However, we have two unique features. So this guy right here is going to be our costal facet, and this guy over here, top and bottom, are going to be known as the demifacet. So the costal facet is going to exist on the transverse process of our thoracic vertebrae. The demifacets are going to exist on the vertebral bodies of our thoracic vertebrae. And the reason why we have these extra facets, this costal and demifacet, is actually to allow for the articulation of our ribs and to attach onto the thoracic vertebrae in that instance. Now, the way that they actually are going to articulate is if we take a look here. On the costal facet of the transverse process is where the tubercle of our rib will connect. Further down, our head of the rib is going to articulate with the demifacets on the vertebral bodies themselves. So you can kind of see the correlation: costal facet on the transverse process with the tubercle, and demifacets on the vertebral body with the head. Getting into the ribs just a little bit, the only thing I really need you to know about the ribs is the head of the rib. That's the part that connects onto the vertebrae. The neck always follows the head. The tubercle of the rib. The angle refers to when the rib starts to bend over. The costal groove is going to be this small indentation on the inferior aspect of the body of the rib. Body just refers to the general mass of the rib. This costal groove is very important because it actually protects some of our intercostal nerves, arteries, and veins. Pretty much, we have nerves, arteries, and veins kind of like branching along here, and we want to be able to protect those guys. Let's see. Okay. Moving on to the sternum. We have three parts to the sternum. We have the manubrium, the body, and the xiphoid process. Now, when we're actually taking a look at the sternum, there's actually a really easy way to go about drawing it. All you're going to do is start with a small little square, right? We're going to continue down as a rectangle, and then the final piece is going to be an upside down triangle. So it kind of looks like a formal tie, right? Our skeleton, this guy right here, he is super fancy. He always has a tie ready for any occasion. And this is actually what we're using to actually show off the sternum, the center portion of our chest here. So this top portion that we kind of reference as the square, this is going to be our manubrium. The long rectangle is going to be the body. And this little small upside down triangle down here is going to be known as the xiphoid process. So now that we got that guy out of the way, let's go ahead and talk about some of the differences between these three types of ribs. We have vertebral sternal ribs, vertebral chondral ribs, and just vertebral ribs. Now the vertebral sternal, if we break up that word, right, we're going to cut it off about here. Vertebro is generally referring to vertebrae, so that means that this rib is going to attach onto a vertebrae. And sternal generally refers to sternum. So this rib is going to attach onto the vertebrae and to the sternum. That's why we're going to call these guys, the vertebral sternal ribs, we're going to call them the true ribs. Just like that, the true ribs. Now, the true ribs consist of rib pairs 1 through 7. Now, notice how I said rib pairs, right? Because when I'm dealing with rib pairs, I want to make sure that I'm able to count these properly. So this would only be counting one side. So 1, 2, 3, 4, 5, 6, 7. However, in the instance if I asked you how many true ribs do we have, the correct answer would actually be 14 because we have a left side and we have a right side. So this is generally referred to as a pair. Looking at vertebral chondral, once again, let's cut it off at the O. Vertebral refers to vertebrae and chondral refers to cartilage. So as you can see down here for our ribs 8, 9, and 10, these guys all generally converge onto a single piece of cartilage tissue that then travels all the way up and attaches onto the sternum. These guys are going to be known as the false ribs. And this is generally going to refer to ribs 8, 9, and 10. Now, false ribs here refers to 8 through 12. I'm going to get into that in just a little bit because we actually have a unique name for the vertebral ribs too. So the vertebral ribs, right, just connects onto the vertebrae. This is going to be ribs 11 and 12, and they don't connect onto anything else. They are literally just floating there. So what we're going to call these guys are the floating ribs. Now, pretty much the only time we use the term false ribs is when it does not connect directly to the sternum. So since these floating ribs never connect to the sternum and these chondral ribs only partially connect to the sternum, we're going to consider all of these guys considered false ribs. Looking at the lumbar vertebrae, these guys are pretty typical. Everything we've described, there's not really anything else unique to be described for the lumbar vertebrae. They just have everything you'd expect. If you have trouble differentiating between lumbar and thoracic vertebrae, there's actually a pretty simple method. Cervical vertebrae are very easy. They have those transverse foramen. So if you're able to identify those transverse foramen, cervical vertebrae every time. The lumbar vertebrae typically are much bigger in mass, and their spinous process is generally a lot more straightforward. Also, another method that I often use is if you are taking a look at the lateral view of our vertebrae like this lumbar vertebrae looks like a moose. I'm not sure how else to describe it. You got this big old snout coming up and over. You got like his antlers right about here. This would be like his eyeball, right? You got like, I'm not a moose anatomist, so whatever this thing is kind of hanging down. I just know moose have them, right? And then this will just kind of be attaching his neck onto his body. Kind of looks like a moose, right? If we actually take a look at the thoracic vertebrae, they also have a similar process. So I'm going to go ahead and erase some of these guys over here. If we're taking a look at the thoracic vertebrae from a lateral view, this kind of looks like a giraffe. So for the giraffe, we actually have a super long nose that's generally pointed downward. We got his ears kind of coming up and across right here. We got his horns that are right there, and then again connects the neck to the rest of his body. And his eye would be like probably, I'd have to guess right there. That's a really demonic looking giraffe, but that's kind of the idea. All right, just to wrap this up real quick, the cervical and lumbar vertebrae are considered what is known as primary curvature. Sorry, made a mistake right there, and I don't feel like editing that out. Cervical and lumbar vertebrae are actually considered secondary curvature. See, even a veterinary anatomist like myself can make mistakes sometimes. So cervical and lumbar are known as secondary curvature, versus thoracic and sacral is referred to as our primary curvature. And these primary and secondary curvatures kind of work in groups. And you'll actually notice that we have a few different pathological conditions here. So we have kyphosis. Kyphosis refers to our primary curvature of the thoracic and sacral vertebrae, and kind of refers to basically when these guys are overexpressed, right? And because of this overexpression, we have this kyphotic kind of hunchback look. Basically, our thoracic vertebrae and our sacral vertebrae are jutting out too much. Lordosis refers to our secondary curvature. So that would be lumbar and that would be cervical. And lordosis is actually going to result in our overexpression of the lumbar and cervical vertebrae as pressing deeper into our body. So we can actually see this over here. You can actually see this like curvature inward, right? Most often, the best example is pregnant women. However, this can affect just about anybody, usually due a variety of different genetic conditions. And then finally, scoliosis is kind of its own thing. It's irrelevant of the primary and secondary curvatures, and it just refers to when your back is pushed laterally. So you can kind of see how that's not very straight. All right, but that, for the most part, concludes our axial skeleton. Hope you guys enjoyed the video.